Wiltz, and I'm going to show y'all how to insert a Bridle nasal tube retaining system. This tube is used on patients that, number one, may have skin irritations, number two, children that may pull out their tubes, and number three, a easy system to use so you can be a little bit more attractive, I think. Okay? So what I have in my hand is the actual Bridle system. The patient, once you've identified yourself and who you are, and have identified that you do have the right patient, and this patient does require an NG tube, and you've explained to the patient exactly what's going to happen. I've passed out the brochures that we give out to patients, so y'all can just look that over to see what actually is going to be taking place. So you're going to explain to the patient that this is a two-part system. And even though we're inserting this into the patient's nose, I mean, it can be uncomfortable. So you can either place the Bridle in before the tube, or you can place the Bridle in after the tube is placed. Right now, Mr. Skull has this tube already in there, as so. So we're going to place the Bridle in after we've inserted the NG tube.
What's that blue thing called?
It's called part of the Bridle. And actually, these two pieces, once I insert it into the nose, they are a magnet. So they stick together in order for you to bring out the tube, as I will show you in a moment. This piece has the umbilical tape attached to it, and this is what actually will be hanging out of the patient's nose once we've clamped it to him. This is a little stylet that's also used to insert the tube into the patient's nair. So you're going to lubricate both of these with KY jelly. The better lubricant, the more, there's no excessive type of lubrication, so the better for the patient. The white part goes into the side with the nair. I mean, goes into the side with the tube. The blue goes into the opposite end, and I'll show you kind of why. Well, you'll see kind of why. So you can insert these at the, remember these are very attached. You can insert these at the same time. Okay. You're going to hear a click. Just how you see that, that's how you're going to feel it once you've inserted it into the patient's nose. And I heard the click. So now once I hear the click, I'm going to take out the stylet part into the white tube. And then I'm going to pull back on the blue one, and then the white one's going to come through the opposite end. I'm not going to cut it because afterwards I'm going to allow y'all to practice on this. So we're not going to cut the tube. But in the real world, you'll cut the umbilical tape after you've applied the clamp. You're going to apply the clamp not so close to the patient's nose, but just about a good 1.5 inches away from the patient's nose, as so. So you'll apply the clamp as so to the patient's nostril. I mean to the patient, closest to the patient's nostril. Okay. Then you're going to tie a knot at the end of this. So as you can see, this tube is not coming out of the patient's nose. And once again, that helps so the patient won't have to have any tape on their nose, on their face, or if they have any tape allergies. And I'm pulling on this really hard, but I wouldn't suggest that the patient do that.
What is the name of that bone that goes around?
It goes around in the inside. It's called a vomer bone. And that's what this umbilical tape is actually attached to in the patient's skull part. And as you see, I'm pulling on this, and it's not budging. But I wouldn't advise the patient to pull on this.
So does it hurt the patient if they pull on it?
Yes, it does. And how I know that, we practiced on a human being, and we tugged on it, and it did hurt. So we have to advise the patient not to really mess with it. And also, if it's young children, make sure we tell the parents that, you know, even though this cannot come out, we don't want the kid to even mess with it at least. This is just for, I guess, allergies and cosmetic to me, because I think it looks a little bit more attractive without the tape all over the patient's face. Any more questions?
So if you don't have the clamp, can you still just tie it around the tube, the NG tube?
You can tie a knot, but it will slip. So the clamp is
that's
very
true.
beneficial.
Oh, okay.
Only what you're doing is tying a knot at the end of the clamp.
Oh, okay.
So the clamp actually has two little areas, one for the umbilical tape and one for the NG tube?
Exactly.
Oh, very nice.
There's a little bigger hole there, and then the tape slides here. You can't really pull on the tape because it's actually snug as well too, but the clamp is very beneficial. Without the tape's very beneficial. You know, without this, it would still probably be able to be untied.
Okay.
Thank you for listening.